Walking, a simple, familiar form of exercise that is always encouraged for all ages, especially those over 40. The feeling of freedom with each rhythmic step, breathing in fresh air, listening to the slow pace of life. Walking seems like a remedy for health, but in reality, many people face a worry. Their knee joints suddenly swell, feel hot, and even ache after each workout. The journey to maintain health suddenly turns into a nightmare for the knee joints, and if not addressed promptly, this can lead to lasting consequences: chronic arthritis, joint degeneration, and long-term impact on mobility. But the good news is, if you know how to properly handle it right when the knee just starts to swell, you can completely reduce inflammation and pain quickly, prevent the damage from spreading, and continue maintaining a healthy walking habit. To do that, we need to clearly understand the causes of knee swelling after walking, the principles of cold and warm compresses, how to apply the techniques correctly, gentle rehabilitation exercises, and important notes to protect the knee joint every day. So, what has caused your knee to easily swell after such seemingly gentle walking sessions? First of all, overexertion is a common cause. When you walk for too long or suddenly increase your speed, the knee joint bears a heavy load while the cartilage, ligaments, and surrounding tissues have not yet adapted. The pressure on the joint causes the soft tissues to become mildly inflamed and swollen, sometimes accompanied by a sensation of heat and redness. This is the body's natural response to mechanical injury. Secondly, terrain and road surface also play an important role in affecting the knee joint. If you walk on steep paths or hard surfaces like cement, bricks, or stones, the impact force transmitted from the foot to the knee joint is much stronger compared to walking on soft ground or grass. The lack of shock absorption in each step causes the soft tissues around the joint to be easily damaged, triggering an inflammatory response. Third, inappropriate footwear is the culprit causing knee joint swelling that few people notice. If you walk for exercise wearing shoes that are too stiff, have thin soles, or do not support the arch of the foot, the impact force from the ground is directly transmitted to the knee joint. In particular, using flip-flops or high heels for walking exercise further increases the risk of knee swelling because they do not help distribute the force evenly across the small joints of the foot, causing all the pressure to concentrate on the knee. In addition, some underlying conditions can also cause the knee joint to swell even with light movement. If you have had knee osteoarthritis, rheumatoid arthritis, gout, or previous joint injuries, the tissues around the joint are weakened and prone to fluid accumulation, knee joint effusion. Just one slightly strenuous walk can cause the knee to swell, hurt, and be difficult to recover. So, when the knee swells after walking, what is the first and most effective solution? Cold compress. Warm compress are two simple but extremely useful methods if applied at the right time and with the correct technique. The golden rule when treating a swollen knee joint is apply cold compresses when it first swells and shows signs of inflammation. Apply warm compresses after 48 hours when the swelling has reduced, but the joint is still stiff and sore. Why is that? Cold compresses help reduce swelling, constrict blood vessels, and limit the spread of damage. When the knee area is injured, the body increases blood flow to repair it, but this also causes the joint area to become swollen, hot, and red. Cold compresses help shrink blood vessels, reduce the amount of blood flowing to the area, thereby quickly reducing inflammation and swelling. On the other hand, applying warmth is effective when the knee swelling has reduced, but you still feel soreness and difficulty moving. The warm temperature helps dilate blood vessels, increase blood circulation, promote the recovery of joint tissues, reduce joint stiffness, and make it easier for you to move. If applied at the wrong time, the condition can worsen. Applying warmth immediately when swelling first occurs will cause more blood to rush to the area, increasing the swelling. Applying cold for too long when the knee has already recovered will reduce circulation and hinder the tissue healing process. So, how to apply cold compress most effectively to reduce inflammation when you just have a swollen knee? First, you need to prepare a specialized cold compress bag, or more simply, a clean plastic bag filled with ice cubes. Never place ice directly on the skin. This can easily cause frostbite and damage the skin tissue. Use a thin towel to wrap the compress bag, which helps distribute the cold evenly and protects the sensitive skin around the knee. When performing, you should sit or lie in a comfortable position, raising your knee slightly above the heart to reduce blood flow to the knee joint. Place the compress bag on the swollen knee area, making sure to apply it only to the swollen spot, not the entire joint if only one side is injured. Cold compress duration, 15 to 20 minutes each time, spaced 2 to 3 hours apart, repeated during the day if necessary. After applying the cold compress, rest for at least 30 minutes before resuming light activity. Important note: do not apply ice directly to the skin. Do not apply for more than 20 minutes at a time to avoid excessive vasoconstriction and tissue damage. Do not use an ice pack that is too heavy, causing pressure on the joint. After 48 hours, when the knee swelling has reduced but still feels stiff and sore, you can switch to warm compresses to aid recovery. Prepare a warm compress bag, a hot water bottle wrapped in a towel, or a warm, damp cloth with a safe temperature of about 40 to 45 degrees Celsius. Avoid using excessively high heat to prevent skin burns or deep tissue damage. When applying a warm compress, sit relaxed and place the pillow in the most comfortable position. Place the warm compress bag on the knee joint area, making sure not to place it directly on bare skin. Keep it on for about 15-20 minutes each time, 2 to 3 times a day. Warm compresses help increase blood circulation, delivering more nutrients and oxygen to the joint tissues, promoting the healing process. Additionally, the warm temperature helps reduce muscle stiffness, improve motor function, and prevent prolonged joint stiffness. When the knee swelling has reduced and the acute inflammation has subsided, you can start light exercises to restore mobility. These exercises should be done very gently without overexerting yourself. Gently straighten the knee when sitting or lying down. This simple movement helps circulate joint fluid, maintain flexibility without putting strong pressure on the knee. Straight leg raise. Lie on your back, lift one leg about 20 to 30 centimeters off the ground. Hold for 5 seconds, then lower it. Repeat with the other leg. This exercise helps strengthen the thigh muscles and supports knee joint stability. Pedal in place with light force. If you have an exercise bike, you can pedal slowly to increase joint circulation without putting too much pressure. Alongside the treatment methods, when the knee is swollen, you also need to remember important advice to prevent this condition each time you walk. Warm up thoroughly for 5-10 minutes before walking, focusing on gently rotating the knee joints and stretching to prepare the joints and muscles. Choose sports shoes with soft soles that provide good support for the arch, helping to reduce impact force on the knee joints. Gradually increase the distance and training speed. Do not increase abruptly. The body needs time to adapt to the new level of activity. Prioritize walking on flat surfaces. Avoid climbing slopes or hard surfaces if you are not used to it. Any change in terrain increases pressure on the knee joints. Supplement essential nutrients for the joints. Omega-3 reduces inflammation. Calcium increases bone strength. Vitamin D supports calcium absorption, protects the joints. There are cases where, despite applying all measures such as cold and warm compresses, rest, and rehabilitation exercises, the knee joint still does not reduce swelling or pain. When do you need to see a doctor? If the knee swelling lasts for more than 3 days without reducing. Severe pain, unable to bend or straighten the knee normally. There is a clicking or cracking sound when moving the joint. You have a history of knee injury or joint disease. Do not be subjective about this sign, as it may warn of serious problems such as joint effusion, cartilage damage, ligament injury, or progressive degeneration. In summary, knee swelling after walking is not uncommon, especially in middle-aged and elderly people, those whose joints have already begun to degenerate and are vulnerable. However, if you properly treat it with cold compresses when the swelling first appears, use warm compresses to support recovery, and combine with gentle exercises, you can quickly reduce inflammation, prevent joint damage from spreading, and maintain a healthy walking habit without worrying about knee pain. Remember, walking is one of the great forms of exercise for the heart, joints, and mind. But protecting the knee joint, the hinge of every step, is even more important. Don't let moments of healthy activity turn into a nightmare of pain and inflammation. Listen to your body, promptly address any unusual symptoms, and maintain your walking habit with complete peace of mind. If you have ever experienced knee swelling after walking, try applying the tips for cold and warm compresses at the right time and with the proper technique as shared. Don't forget to warm up thoroughly, choose suitable shoes, listen to your body, and supplement nutrients to nourish your joints. With just a little attention, you will see healthier knees, more flexible movement, and fully enjoy the joy of every step on your journey to maintaining health. Because every step you take is a journey that cherishes your feet, and healthy feet are the foundation for an active, joyful, and vibrant life. With healthy knees, you will confidently conquer every path and enjoy every moment of life without worrying about sudden pains. Apply these small but useful tips as soon as your knee swells, and you will notice a clear change. Inflammation reduces quickly, pain disappears, and the knee joint recovers quickly and safely. This is the secret to helping you protect your knee joints long-term, maintain a healthy walking habit, and enjoy strong health every day. Walking is good for health, but protecting the knee joints is even more important. Start with the smallest things. Listen to every signal from your body, and don't let any pain stop you from continuing your journey of healthy, energetic, and happy movement.